Welcome to Defense Art TV. I'm your host, Sifu Robert Brown. Today's show is about body targets and what happens when we strike them. It features Dr. Mike Savona, Hawaii's Doctor of the Year for 2003. So stay tuned for the effects of striking vital zones on Defense Art TV.
Aloha, my name is Sifu Douglas McLeod. We have our special guest, Dr. Savona. Thank you for coming.
You're very welcome, Doug. The neck is an area where there are a lot of structures that are attackable, are targets. There are a couple of things, though, that I would bring up. One is that women have long necks, and so they are the better targets, of course. But I mean, we don't, most of the time your attacker isn't going to be a woman. And with men, we have shorter necks, which limit the space. And what's going to be somebody's first response to a strike to their neck? Put their head down. And that's an effective way of blocking it. And then, of course, if you are striking, especially if you're using a spear hand or your fingers, you're going to be striking bones. It's going to hurt. Okay, so the issue here, if you're going to go for the neck, is probably you have to have someone in a position where their neck is exposed. You have to be quick in order to do it. And the point I would make is that there are a number of structures here that are worth looking at as targets. Most of them are off of the midline, except for the trachea and the larynx, and we'll talk about that in a minute. But if you look at the neck here, again, the yellow is the nerves. There's lots of nerves that course down. This is just right under the surface musculature of the neck. This here is called the sternocleidomastoid muscle, which means the strap-like muscle that's right here. It covers over the jugular vein, which you can see here is kind of cut away, but that lies there. And this is part of the carotid system, which has also been removed. And there's lots of nerve plexes here. And these are very, very tender areas to strike at. So the area to look for is high up in the neck here, if you can access it. But you have to, like I say, be quick, because if someone puts their head down here and you're coming up, what are you going to hit? Jaw. It's going to hurt you probably more than them. Okay. Now the carotid vessel right here, right up under the jaw, is where the common carotid breaks off into two subdivisions, the internal carotid and the external carotid. And it's an area where the vessel becomes actually a little fatter, and we call that the carotid bulb. And that's another area that's rich in nerve tissue, and that's the other area we often use when we want to break somebody who has rapid heartbeat. But stimulating that also causes much the same thing as the eye. So a blow there, not only is it very painful, but it can drop somebody's pulse from 100 to 40 and their blood pressure from 120 to 30 in a matter of a few seconds. So it's an area that is worthwhile to consider as a target.
So this is what
if you want to feel it, if you can put your hand up here, you'll actually feel pulsation there. And if you put your hand against it, that's again not a comfortable area to keep any fingers against. Okay.
But that would knock a person out. I mean.
Oh, for sure. For two, of course.
Blood, right?
You could stop the blood, but also just the stimulus to that area creates a nervous sequence that actually slows the heart. Okay, so that's an area too, and of course that's the area if you're choking somebody. That's the area to go for. Right. When people do a chokehold, that's what they're trying to constrict. Everybody talks about jugular veins. They have nothing to do with jugular veins. Jugular veins are veins that drain the blood out of the head. Holding them will make somebody's face look redder and more engorged because you're interfering with venous blood flow. Yeah, just like as if when you go to get blood drawn from and they put a tourniquet on your arm. But it's not going to do anything to stop someone unless it's transected. Then of course it can bleed a great deal, and that can be a problem. But so those are the areas that are the areas to go for. This right here is the thyroid gland. The thyroid gland sits right in the center here over the so-called Adam's apple. Okay. And this is a strike point, but not so much for the thyroid gland, although it's very vascular, tender. A strike there will cause a hematoma there and make somebody feel pretty uncomfortable. This is a sagittal section cutting down through the head. So and my purpose for showing it is just looking at some of the anatomy here. The tongue is a very thick and vascular tissue. There's a lot of sensitivity here, but I do not encourage anybody to stick their fingers in anybody else's mouth. It's not while they're awake, because that's a good way to get bit yourself and lose some fingers. But this is also very sensitive tissue. This is the area here where if you apply some pressure, like I say, you can bring somebody very quickly. If you just put your finger there and press a little bit, very uncomfortable. And you can get somebody right up on their toes. And that's something you can hold on to, because you can't tilt your head back enough to escape it, whereas somebody holding onto your nose like this, you can. But over here, there's, when you and I swallow, food goes down this back channel, which we call the esophagus. And over here is a panel that's called the epiglottis that slides down and covers this, which is our windpipe or trachea. And this area here is called the larynx. These are the vocal cords, and this is how you and I make noise by wind blowing past it and then vibrating. Yeah. Now, why do we show this? Well, right here, where this bulge is the cartilaginous makeup of the larynx anterior. We call this the Adam's apple. I'm not sure why it was ever named that way, but that's it. Now, this is actually a Adam. Why the apple? I don't know. In any event, the issue with this is that this is a secondary sexual characteristic. Men have this at a more acute angle, which is why men have a more prominent Adam's apple. Okay, and they use this in forensic medicine to decide if a victim, male or female, long after the fact. This is one of the things, one of a number of things that can be looked at, because cartilage doesn't decompose very well. So even in people years gone, they can make a determination, male or female, on the basis of it. But what has this got to do with anything? Well, what this has to deal with is that it's because of the angle, and what we're talking about is this right here. Because, and this is like one way to think of it is like a shield, is how it looks face on. Because it's a more acute angle in a man, it is more susceptible to fracture. And it can be easily fractured with a blow. What happens when that occurs? You can occlude somebody's airway. So you need to be careful about this, because this is something that could be very serious. You can collapse somebody's larynx and their airway and they couldn't breathe. But it's incredibly painful, of course, to have that happen if you hit somebody in that area. And it makes it another area to consider as a target in this region.